Hi guys, welcome to my channel. It's soy_sweet99 and I just wanted you guys to know a couple of things. Like, as you can see by the title, I was in the hospital. Yeah, it was only for a few days. But to my followers that are on my channel that have been following me and following up with my health condition, my thoracic spinal fusion surgery that I had in December of 2017, about 6 years ago, 6 years and a couple months to be exact, I just wanted to provide you guys with an update. So, go look at, I'm going to provide a link if you haven't seen those videos, update videos on what happened to me in the surgery. I'll put some links somewhere up here where you'll see the videos about the surgery. But I had thoracic spinal fusion surgery to walk again. I became paralyzed in December of 2017. I had surgery December 12th. And I've been going through complications here and there with the healing process. But overall, I kind of been better in the last 2 years or so, I would say, where I haven't really had too many flare-ups. But the surgery was needed for me to walk again, according to my neurosurgeon at the time. But most recently, February of this year, it's 2024, I had another really, really big flare-up, and I was feeling symptoms of, well, actually, no, it started in December of last year, December 10th-ish. Ironically, which was around the same day that I had I ended up in the hospital 6 years prior. And I was feeling like the sensations of not, like, I couldn't get up out of my bed. Like, I felt like I couldn't walk. Like, it was raining so heavy that day, and my best friend was supposed to come over and check on me and take care of me. And I'm calling him. He's calling me. We're playing phone tag the whole day. I'm wondering why he's not coming. And not gonna cry now when I say it, but he was on his way to the ER and he died the next day. And I basically had to prepare his funeral. So I went through a lot. Like, I was waiting for him to come and get me, and he needed my help, to take care of him. And he passed away from an aortic dissection, which is very unfortunate, and he is dearly missed. But anyway, I got well enough to attend his funeral and memorial services and speak at the services and everything. And then January-ish, I was okay. Then I went and as you could see, I'm trying to show you guys on camera, these braids in my hair. I went in and tried to do my hair. So you can see these braids are really, really small. You can see how tiny they are. I just been wearing little braids this whole time, right? So I went in to try to retouch some of my hair, and guys, I'm sorry, I'm out of it, so I'm not made up, no makeup, no nothing right now. But I went in to try to retouch some of my hair, and I don't really know what caused the flare up. I really can't say, because I went to have an root canal done on February 1st. And when I had the root canal done, the endodontist accidentally paralyzed my facial nerves while giving me an alveolar nerve block. So the same area where the parotid gland is where the facial nerves are, is the same area as the alveolar nerve back. If you don't go back far enough, you'll paralyze someone's facial nerves. So my face was like that for like 72 hours, where it looked like I had a stroke on one side, and I had to go to urgent care. I went to my dentist. They were saying that it's a rare chance this happens, but I was so scared. So anyway, once that resolved, I'm just at home doing my hair. I just got a flare up. My legs started hurting. My joints started hurting. All the same symptoms that I was getting before when I got paralyzed in 2017. So I had joint pain. I had leg pain. Then I started feeling like symptoms of sciatica again, like nerve pain, muscle weakness, pain running from my incision, which is here in the back. Let me turn around so you guys can see. So my incision is back here, and hopefully you can see that. So that's my incision 6 years later. So I had pain that came from here, ran around to here, wrapped around my ribs in the front, down my left leg, into my foot, and in my butt and my left hip. And then I would have random sporadic pain in my shoulder joints, my elbow joints, my knuckles and everything. Like, and until I stopped being able to even climb stairs again. So now I'm going back and forth to doctors once again, just like I did 6 years ago. And I'm trying to explain to them, like, what's going on. Like, okay, I'm not walking. So my primary care doctor ordered an MRI of my thoracic spine. Went and got that done, like, in the middle of the month. And because when I came to her, I barely could walk. Like, I literally was using this cane right here. I couldn't walk. And I'm like, okay, I'm just barely making it in her office. And I'm explaining to her what happened. And then I didn't know what was going on. I'm like, there's a part of me that feels like when my period is about to become, maybe a week or two before, after ovulation, the symptoms flare up. But I didn't know if it was period related, what the hell was going on. So anyway, I go, she orders the MRI. I get it done. The results come back and the MRI shows that everything's fine. I mean, it wasn't very descriptive because it was done at the same hospital that I had the surgery at, which I'm going to talk about that after. St. John's Hospital in Yonkers, New York. Worst doctors ever. And I'm sorry to say that because my primary care doctor is there, but they're horrible. Oh my gosh. And I worked in the medical field for so many years. The doctors there, they do not question you enough. And I'm going to tell you about my experience in the hospital. So I did an MRI. MRI came back fine. She ordered a lumbar spine MRI. The lumbar spine MRI was denied by insurance because she didn't submit enough documents, which I thought was so stupid. Like, so now I finally got it approved by another neurosurgeon who I go to. And I'm like, look, he's like, your legs, your reflexes, my reflexes in the left leg are completely dead. I can't lift it on my own or nothing like that. And he's like, this is strange to me, but I feel like I'm going to order your MRIs, but I feel like this is possibly, now mind you, I'm telling him I had these symptoms before, 6 years before. It could possibly be your, something that may be dealing with the myelin sheath. Like, and he'll refer me to a neurologist if nothing comes back in the lumbar spine. Now, mind you guys, I do have a L5-S1 disc herniation in the lumbar spine, which I've had from 10 years ago, a car accident. It bothered me then. I did physical therapy and I get sciatic symptoms here and there, but I'm not sure where it's coming from, the thoracic or lumbar. I have a C5 to C6 and a C6 to C7 disc herniation that shows up on MRIs most of the time. One is has thecal sac impingement or impingement, or both of them do. Sometimes one shows and the other doesn't. So anyway, so the MRIs get ordered Sunday, this past Sunday. I'm trying to go outside to go to get my nails done and do stuff for the day. And I feel like I could barely move my legs. Like my legs felt like they were Barbie legs. You know how when you take the Barbie doll, when we were little and you bend the legs on a Barbie doll and it's like rubber? Exactly like it felt and I described in my old video from 6 years ago. I'm like, I gotta try to get myself to the emergency room because I don't want to go paralyzed again like I did before. So I'm just like going crazy. Like, no, I'm about to get paralyzed all over again. Fast forward to 6 years later. So I go to the ER. They immediately start asking me stupid questions. These students, I tell them on my history. I had surgery there. They're asking me all type of weird stuff. Are you an IV drug user? It's not a stigma, but are you an IV drug user? Have you used IV drugs? And I'm like, what are you talking about? Like my primary care doctors here, you could clearly see in my records, my history, and they're asking me these foolish questions, which was pissing me the hell off because I was in so much pain. The doctor didn't even help me to get up on the exam table, which I could barely get on. And I guess because I told them that I fell, they ended up deciding to admit me for MRIs of the spine. So now I get admitted, I get on a unit, and more doctors are coming and students. Like, they're there talking. I'm explaining the same thing over and over again. I went paralyzed 6 years ago. I feel like I'm going paralyzed again. I don't know what's going on with the thoracic spine area. They're telling me they're going to call my neurosurgeon who did the surgery back then. I no longer see him, but they're telling me that they're going to call him. They never called him. Instead, they send a neurologist by, which I was okay with at the time because I'm like, this could be a neurological condition. Maybe it's something different. He tests my legs. He does everything. I barely could move my legs. I couldn't get up. I had to use the bathroom. He escorted me to the bathroom. I had a wheelchair by my bed, and I had my cane in the room. So he goes to the bathroom. Now, I have access to the patient portal as I'm there. So I was curious because they come in with meds for me and they give me medications. They said the doctor thinks I have restless leg syndrome. Yes, restless leg syndrome. Not even, they say nothing about my spine. And I'm like, when am I going to get my spine checked? Because even to sleep and turn over, my whole body was just in severe pain. I'm talking about to move my arm, to just sleep at night. They was like, we're going to give you something to sleep. He gave me something called Mirapex. I took that and I started feeling kind of sick after. And then they gave me this medication called Nadolol, because he said, he kept coercing me and saying, I know you get migraines. Don't you get migraines? You get migraines. So he put my diagnosis down as migraines and restless leg syndrome. Nothing about my spine. So all the doctors that are visiting me after that are all talking about restless leg syndrome and my spine. I threw up like hell the next day. I was so nauseous, blurred vision, whatever medication they were giving me, it had me so sick, and they kept trying to force it on me. And I'm like, where is my neurosurgeon? Where's my neurosurgeon? Then physical therapy came. They wanted to discharge me by the third day. I got up to walk. No one who came in my room ever asked me to walk. This is the thing that I hate about our current state of healthcare. Back in the days, doctors had way better bedside manner. Like, how do you examine a patient? Even though I was in pain, yes, but at least see what my gait looks like. See if I'm walking the way I'm telling you I am. They didn't even see me walk till physical therapy came and realized I couldn't even get that far with my cane. So they provided me with a walker, which I'll show you. I have a walker. I was discharged home with a walker. Here's my walker. And it really, really helps for me to walk. And I was discharged home after 3 to 4 days and just told to follow up and get follow-up outside MRIs. And when I looked at the discharge paperwork, it did say left paresthesia and paralysis on the left side, but it also said migraine headaches. Migraine headaches. I barely get regular headaches. This is just crazy. This is medical gaslighting, and it's horrific, horrendous, and terrible. This, like, as someone who worked in the medical field myself for years, know the terminology. They couldn't pull the blanket over my eyes, but you still wrote the wrong thing in my medical note. They also put that the reason they didn't do MRIs was because I told them that I had an MRI in December. Go figure. So now, basically, I really wanted to make this video to just relate to you guys that may have had spine conditions or any other conditions, period. Please advocate for yourselves. Like, if you push and push, because now I've been discharged from the hospital, and there's a part of me that feel like, yes, I feel like this has to do with my spine because the pain, it just wraps around in the same area. But there's another side of me that wonders, is there another condition that developed? And now I still have to go back to other doctors to figure it out. Yes, I have MRI scheduled for this weekend for my lumbar and my C-spine, my cervical spine, because I barely was able to turn my neck, but so far when I was in the hospital. But in my mind, I'm just sitting here like, okay, there's a whole bunch of other issues that could be going on with me that I go to the doctor regularly, but I still keep feeling like, is there something that they missed? They never even asked me any questions like any gynecological issues, like, do you have any pain in the ovaries? Which I realized that my right ovary was kind of hurting. I've been having constant urination. I don't know if maybe that could be because of my back, but I've been urinating all day, all night, even when I don't drink anything. And I've been complaining about this since January. It is now March, and I really still don't know, but I'm making this video and putting it on my channel also so that I could look back in history. If something is ever found on me or I get a new diagnosis, that I could look back and say, hey, I felt the symptoms. I went to the ER. I got admitted to the hospital. I wasn't taken seriously, but I felt the symptoms. I even been looking up symptoms of ovarian cancer. Like, what are the symptoms? And they're pretty similar too. You can feel sciatic nerve pain, Rheumatoid arthritis also runs in my family. So I'm like, okay, do I have another condition combined? I just had a physical, I just had an ultrasound, I just had all of this done, but maybe there's something that they're missing. Or maybe it could just be that my thoracic spine is flaring up again, but this is the longest flare up I've ever had. Maybe there's nerve impingement, but I'll do an update and I'm going to show you guys my MRI when I get the results back for my lumbar and my C-spine. So I want in the comments for anybody who's had herniated disc, who's had thoracic spinal fusion, who's had any type of surgery, even if you didn't have surgery or you went to the doctor before and they dismissed, or you've gotten gaslit by a medical professional and they ignored your symptoms and you found out later that it was something else, or you have some type of neuropathy, or you have some type of sensation in your legs, or you weren't able to walk. I'm home with a walker right now, and I have, a home attendant that comes throughout the day, but I also can't prepare meals for myself because when I stand long, I feel like I'm about to collapse. And this is 6 years post spinal fusion. So I also would like to know in the comments if anyone has had spinal fusion and they had any type of anything like this happen after, because I've been pretty active afterwards. I can't say it's because I've been sitting down and I've been doing this and I've been sedentary or whatever. At first I thought it was because I went up a couple flights of stairs and maybe something could have happened to my back, but I don't know what it is. So I would love feedback from you guys so that you can let me know. Have you ever agitated yourself after spinal fusion? Have you ever had your condition worsened after you got spinal fusion? If you haven't got spinal fusion, do you have any back issues? Have you been gaslit by medical professionals? Has anyone ever had their facial nerves paralyzed after dental work and you had a onset of another condition after? I really don't know. Another thing that I would like to know from you guys in the comments too is if you had spinal fusion or any type of metal in your body, because remember, I do have metal in my back and I also have metal in my wrist because I broke my wrist 2 years ago and had wrist surgery. Do you take prophylactics before dental work? Do you take amoxicillin, 4 pills, or any other type of penicillin or amoxicillin, anything like that to prevent yourself from basically, because I know the ADA now states that we don't need to take anything with spinal hardware like titanium rods and screws, but I still think it's best to do it. And I didn't do it the first time I went on February 1st to get my root canal done, but I did it the second time because they didn't even ask me. They didn't even give me a paper to fill out asking if I had hardware in my spine. And I feel like after the pandemic, a lot of the doctors who graduated during the pandemic and they didn't really have to do real internships, I feel like a lot of them are very lax and slow as hell. And I'm telling you the truth. They don't ask enough questions and they're very lax. There's no bedside manner. There's no touching of the patient. There's no real examinations or anything. But anyway, guys, that's all I wanted to come to you with. I haven't put up a video in a while, guys, but I'm going to start updating and uploading some of my newer videos so you guys can see. And for my other followers that are following me for my Afro-Latina culture and Panamanian culture and things like that, I'll have a couple videos on that too. I just been, again, like I said, I was in the hospital for a couple of days and I've been under the weather. Thank you guys so much for watching and have a blessed, wonderful day. Bye.